Hi everyone, I'm Dr. K and I'm here with Z. Z's been having some neck problems, particularly on the left side. This is the first time I'm meeting Z. We're doing this as an experiment to see what happens in his range of motion after we use the IntelliRoll on his upper back. We want to affect that area because that's where he's hinging forward, and that's where most human beings hinge forward. And as a result, we collapse all the joints in the neck and we lose our range of motion. Obviously, along the way, you get trigger points and knots that are trying to respond to that forward pressure. So we're going to measure his two ranges. We're going to measure extension and flexion, and then we're going to measure rotation. Okay, so as you sit nice and tall, okay, so the first thing we're going to capture is his neck flexion range. So I'm going to read the top minus the bottom because that's standard measurement practice. Okay, go ahead and flex your neck down. Bend it as far down as you can. Okay, so I'm reading 70 at the top, minus 15, so that's 55 degrees. Come on back up. Okay, and sitting nice and tall again, and we're going to do extension now. So now you're going to bend as far back as you can. Go for it. So that's where you're pretty limited. I got 50 minus 20. So, no, 55 minus 20 is 35. Okay, so extension is pretty limited right now. What did you feel when you looked back? Did you feel any discomfort anywhere?
No, just tight.
And how about if you went down?
Just a stretch.
Stretch, both sides?
Yeah.
Okay, and then when you looked up, what did you feel?
Just
a little compression,
yeah, hitting
right?
the wall.
Okay, now let's measure the ability to use, what's your rotation range? So sitting nice and tall. Okay, go ahead and turn your head to the right as far as you can. So I'm using a goniometer here, and his rotation to the right is just above 80 degrees. Okay, come on back. And let's go ahead, looking straight ahead. Turn your head the other way. Is that as far as you can go? Okay, so he's pushing there 65, so there's a 15-degree difference. So when you're turning this way, what do you feel? Like you can't go any further.
Yeah.
And you feel pressure on this side?
Yeah.
Okay, and when you turn this way, what did you feel?
Yeah.
Much easier,
Much easier.
clearly. So you definitely are restricted turning to the right, to the left.
Right.
Okay, so now let's go ahead and show you. We're going to use the IntelliRoll. So we're going to use the IntelliRoll to improve the mobility in the upper back. So that's all we're going to do. And he's going to do it for less than a minute. So you're going to try to do it for 30 seconds, in fact. Okay? So go ahead and lie on your back. So you're going to center yourself over the spine zone. So if you go over to, and you can feel the knobs, and there you go. So you're kind of there now. Okay? So now get your heels under your butt. Okay? So you have room with which to move. So because of these traction dots, you don't have to push very hard to get on top of it. So all you have to do is just push with your legs a little bit. Don't even lift your butt up, and it'll get you right on top of it. Now, interlace your fingers and hold your head for support. And the idea is to gain extension through that area. So as you move, you're right where I want you to be. Now, stop there. It's going to be some discomfort because you're pushing against the joints and the muscles. Lower your butt down just enough to gain extension. Now roll back and forth right on that spot. Okay? Okay, just release it back and forth, nice and slow. So a lot of people, what they'll do in foam rolling is they'll fly through it with their head forward. So the idea is to gain the extension. And part of the reason they probably do that is because there's direct pressure on the bony prominence of the vertebrae. So the IntelliRoll, we created a spine track where that bony prominence can go, so the pressure is on the joints and the muscles where you need it. Okay, so that's really as much as I would like you to do on an initial basis. Now go through the rest of your spine, so just kind of roll even further back and bring your feet with you. So bring your heels back with you so you keep a nice base of support. And then you're going to go right to the bottom of your rib cage, because our entire mid-back gets stuck forward, but we were particularly interested in getting that upper back. Okay? The cutouts on the side of the center track, call them body tracks, are designed to provide a space for the shoulder blades, but they also provide a nice cupped contour to anywhere else on the body that we want to use. Okay, so now roll out of that and we'll go remeasure. All right, go ahead and have a seat. So we had 55 going forward and we had 35 going back. So sitting nice and tall. Okay, go ahead and flex forward. Good, so I got 70 there minus 10. Come on back. So modest gain of 10 degrees. No, what is that? 5 degrees. Okay, not a huge gain, but still a little bit of a gain. Let's see what happens in extension. Go ahead and bend backwards. All right, so I have 70 there minus 15. Come on back. So that's a nice gain. So that's like a 20 degrees gain. Let's see what happens with turning your head. So you went from 35. Sitting nice and tall, okay? And go ahead and turn your head to the right. That's not where you had the initial restriction. So he's at 87 degrees. Cool, come on back. And let's go the other way. Go ahead and go to the conservatively. You're at 85 degrees. And how's the restriction there?
Less than before.
A little less, right? Awesome. Okay, thank you very much. So using the IntelliRoll, we're able to release the pressure in the joints in the upper back, allowing the neck joints themselves to come into better position, and therefore he's able to restore his range of motion without necessarily having to go and treat the neck directly, because it's really coming from the upper back. It's coming from us hinging forward. So get out of that laptop situation, get into a proper workstation, get an IntelliRoll, and I think you're going to be on your way to a healthier spine.
Awesome.
So